of spring break.
PR Connections Radio presents. This episode of The Professionals is brought to you by Classy Communications PR and Advertising. Classy Communications provides public relations and marketing solutions for businesses, professionals, and nonprofit organizations. They can deliver the true meaning of your business with press releases, social media marketing, web development, email marketing, book publishing, and much more. Wherever your potential clients are, they can help you connect with them. Visit classycommunications.net to learn more about their suite of services that can help your business stand out from the rest. Classy Communications is your solution for business success.
Hello, and my name is Penny Tyndall, and I am the local Summerlin publisher of Desert Foothills Living. I will be hosting this podcast called The Professionals on the first and third Wednesday of every month. Join me as I interview local business owners, community leaders, and nonprofits and hear their story on how they thrive in Las Vegas, what's up in Las Vegas, and just some friendly conversation. So join me on the podcast, The Professionals. Penny Tyndall, thanks again. Have a great day. Hello, everyone. My name is Penny Tyndall. I am a local publisher and neighborhood outreach partner, and I am your host for the podcast called The Professionals. Today, we have actually a personal friend that I have recently met, fantastic at catchball. I think we've all talked about catchball before on my podcast. We have Dr. Nathalie Majorek, and I call her Dr. Nathalie, but let's introduce her. Welcome to the show, Dr. Nathalie.
Thanks, Penny, for having me.
Yes. You know, the interesting part is when I was going out to the Summerlin neighborhoods, I always look for businesses that are advocates for their clients. And when I came across Care Partners MD and Dr. Nathalie, I was impressed because right when you went on that website, it says she is your medical advocate. So talk to me about how that came about, that you had this passion to kind of give everybody the tools to help them, have someone to advocate for their health here in Nevada.
Well, patient advocacy is about, helping a patient, navigate the healthcare system, right? Ensuring that they receive the care that they need, that they're, that they have the tools, the information, and the support they need. Healthcare now has become incredibly complex, and it creates a lot of stress, both for staff, in different offices, but and most importantly for patients, right, that are trying to access care. Patient advocates could be your family member. It could be, a volunteer. It could be, a family friend. But it also needs to have a healthcare professional within that space. It takes a village to help, right? And
Absolutely.
So a physician should be a very integral part of that, healthcare delivery.
Yes, I know that a lot of times when I go to different businesses, somebody gets sick, they always talk about, I'm calling my doctor, the doctor's not calling me back, or I'm not even seeing the doctor, I'm seeing the assistant. I don't think I've ever seen my doctor in the last 4 years. And that's kind of a scary part. So explain to them how you're actually, who they're going to be talking to.
So my office is called Care Partners MD, and I picked that specifically because I want to be a partner in your care. So, being a partner in your care is incredibly important. It's a concierge practice where, and if you're familiar with that model, it's a model where patients will pay a membership fee to deliver, so that they can have this enhanced personalized experience, right?
Right.
So with that, they have my personal cell phone number where they can text or call me anytime, 24/7. They get same day appointments. They have extended appointments up to an hour or more if needed. They have direct access to me, and it's really about building a relationship with that patient.
Yeah, exactly. I mean, that is so critical. I believe that I feel like after COVID, people kind of, a lot of people changed their lifestyle. A lot of people maybe started working for themselves. Maybe their healthcare changed because, they're not no longer with the big dogs or whatever. But when I had mentioned to some of my fellow associates that about your practice, they told me, well, concierge is for the rich and that it's very expensive, but you have broke it down to me, and you're definitely affordable, especially if you want to have someone that you can talk about your health. So let's go over kind of like how your system works. And then after that, let's talk about the three types of patients, because I know I've been patient number one and then went to patient number two and then back to, patient number one. And so sometimes you might want a little bit more connection with your doctor, but it's good to have that relationship. That's what they're building with you, is a personal relationship with their doctor.
Absolutely. I mean, we try to keep it simple, again, because healthcare is so complicated, we try to keep it simple. So, with the annual fee, you have unlimited visits with me, unlimited calls with me. And so you don't have to worry about every visit or every call being billed to your insurance, et cetera, right? Also, when you become a patient, we get the records, your medical records for you. You don't have to bring your stack. You don't have to find all your medical records. My staff will do that for you. If you need a specialist, what I do is I will communicate with that specialist directly, and then we make the appointment for you. So it's really about communication. It's so important. Easy access to communicating with your physician is really the way to improve outcomes, to lead to better health for you.
Absolutely. I mean, in this society, we are such a text, person. And like I tell somebody, today I wasn't feeling well, maybe I called the doctor and they told me 3 months, 6 months. This is a very common problem here in Nevada. And in 3 to 6 months, when I go to that doctor, I might not have that symptom anymore, or I forgot about what I was calling them about. So we're kind of starting over, right? That maybe that symptom went away and now I have another symptom, probably for the same situation. Maybe I'm used to those headaches that I was, saying, oh, I'm getting headaches all the time. Now it's part of my daily routine. So I don't really remember why I went to the doctor. So I love the idea of being able to, text my doctor. They can also, steer me away from going and Googling,
Well,
Googling my system.
so every patient that becomes a member of my practice, once they get my phone number, I say to them, I'd rather hear about an issue than not. Okay, so please text me. I encourage the communication, whether it's text, phone call, whatever, video, whatever they want to use. I'd rather hear about an issue. The other thing also is, if they hear about something in the, in mainstream media or in the, they from a friend about some supplements or other, issues, and they have a question, I encourage that also. Ask me. Send me the article, send me the link. I encourage that, because education is power, so the more you become educated about your well-being and your health and self-care, the healthier you're going to be. So,
well, and that's true. And what's on the internet is not always true. And a lot of people are trying to do their own self-help. which is sometimes detrimental to their health. It's the opposite. And the thing I loved about you is you go and you get their history. I mean, the doctor's going to know the history about your parents and about your, like we were just talking about, your siblings too, because sometimes it could interfere with, your treatment. It might help with your treatment, right? Having
Yeah,
family history.
absolutely. Again, knowledge is power, right? So, the typical primary care office, when go see your doctor, you have, at best 10 minutes or 15 minutes on average, right? And it's a very transactional, situation. You go in for your blood pressure, the physician or the PA or the NP, treat that problem. But sometimes critical information gets overlooked just because there's no time. So if you have a family history, let me just give you an example. If you have a family history of a sibling who has an abdominal aneurysm, you should be screened for that. You should be screened for an abdominal aneurysm because the mortality is 80 to 90%. So that is incredibly important in your overall health. So having a physician who knows your family history, knows your social history, knows a more the whole you, right? So a
Right.
holistic approach leads to better outcomes and better care. And I always tell people, your most valuable asset is not your car or your house. Your most valuable asset is your health. So please take care of it.
That's a good point. I mean, we only have one body, and a lot of times, we take it for granted. And then as we get older, sometimes it could be you get older, or you can have an accident, something that comes about that is unexpected, and then all of a sudden you have, a lot of issues. Like I was dealing with the senior, he got in a motorcycle accident, and it caused a lot of different issues, back issues, leg issues. It also caused depression because he was so active, and then for almost a year he was pretty much bedridden. And so for the traditional doctor, he was going to multiple doctors in California and in Nevada, and they definitely were not communicating. And I love that you also communicate with the specialist, and you kind of do the black and white of the situation. And I think that that's sometimes our physicians talk over our head. And that's where I think we should talk about the three types of patients, because I've been all the different types. So you had talked about three types of patients. So you go ahead and explain it. But I'm going to tell you that a lot of people move around in that depending on their age or their health or their consequences that happen. So go ahead and tell us about that.
So what you're talking about is really about patient engagement, and I love engaging patients in their health. And what does that really mean? It's really about involving patients in their healthcare journey, right? In their health, so they can participate in decision making. They could participate in their self-care, right, and in their wellness. So it's really about, the goal is about, again, improving your health, ultimately. Improving you so that you can have that active life, that you deserve, right?
Absolutely.
And, so patient engagement, I find that there's three types of patients when it comes to patient engagement. You have and you could break it into a third, and that's been studied. So you have those patients. So a third of those patients want their physician to be that traditional model, right? You make the decision, doc. You tell me what I need to do. and I'll do it. So, and some patients, that's okay. If that's what they want somebody to sort of lead, and tell them what to do, and that gives them comfort. That's great. That's about a third. Then you have the other third that really want, they'll communicate with you, but they're sort of on the other extreme where they decide what they want in their wellness. In other words, you can give them all the tools and decision, but it's ultimately they want to make the decision. They want to decide whether they will go with the conventional treatment or whether they want to go an alternative route. And you're there to educate them. And then you have a third that are sort of kind of a mix of both. They want to be educated, but then they want sort of a combination of, that decision, that being their decision, and, the science behind it, right? The science of their condition. So, and it's really up to the physician to respect all three, and really work with the patient, to deliver what they want.
Yeah, I think that that's important because, I noticed that, like when you talk about what the doctor is going to tell you what, they're going to do. I always think of a Western. You'd go to the doctor, at a Western in, the old Western movies, and the doc's like, just take a swig of this every night, and it's gonna help you sleep, and that's all you need. And then you think of a lot of people that go and research on, the internet, and then they get their mind hyped up that this is what they need to do. Hopefully they go to their healthcare person, because a lot of times you might take something you're allergic to, take something that really has nothing to do with you. A lot of people do self-medicate, and I definitely am. I'm a different sphere. Like I always say, I just wait 24 hours, and if it goes away, it goes away. But now that I've gotten older, I feel like people need to journal, and basically that's kind of what they can do in regards to you, because little things can add up. Because we're not really paying attention. We're like, oh, it's just because I'm stressed, or I just got a new job. But it could be also a health thing, not just a mental thing, that's occurring, like women's hormones. A lot of women think they're going nuts. I actually was in a natural grocery store, meeting with one of my clients, and a lady came in and she just started crying. She fell to the ground crying, because her hormones were just so crazy. But she's going to a grocery store and asking the grocer, what should I take for this? Like, to me, it's like, that's crazy. They need to come to someone like you.
Well, that's where, those stories are very unfortunate, or they Google and they, get, there's a lot of misinformation, right? There's a lot of good information on the internet, but there's a lot of misinformation. And again, it depends on you and your condition, right? So, one size doesn't fit all, and you're a unique individual, and that relationship with your physician is critical. So that, if you, for example, if you're a patient of mine and I know your whole history, and you text me and say, I've had the worst headache today. I've never had a headache like this before. Because of your history, I'm going to know, or I'm going to be able to ascertain whether it's something that I need to see you emergently for, and also, what treatment plan needs to happen. So, it's addressed right away.
Perfect.
Opposed to it being ignored and it potentially being something, very detrimental.
And I'll just say on the headache, that can be a big sign. My mom never was sick. She would have headaches that would put her to bed after 50, and then she passed away very quickly. We found out that she was battling leukemia, but she was like, I feel good. You know what I mean? But once we saw that she couldn't do anything for the day, her body was already shutting down. She waited too long, right?
Right.
So a headache can be a very serious thing. It's not drink your water, but yeah, drink your water first.
Yeah.
So, the great thing is I love your story that you have just recently came to Las Vegas, Summerlin. You have so much credentials coming in from Boston. So I'd like to have you kind of give us the scope of your medical expertise because you are very impressive and you're also very nice and friendly. So that you're easy to go. But go ahead and talk to us and let us know how we got such a fabulous doctor here in Summerlin.
All right. Well, I'll just say that I've always wanted to be a physician. I can remember being, from the age of really very young, 5, 6. I just love anatomy and love the concept of medicine. So it's always been a passion of mine for as long as I can remember. So people who say I don't know what to do with my life, I can't relate. For me, it's not just a job. It's a calling, and I'm incredibly privileged to have the ability to work with patients and understand their personal history. It's an incredible privilege to have that. Where people will open up to you where they don't open up to even their spouses. And I always appreciate that, and it humbles me. I started my medical training as a pre-med student at McGill University, which is in Montreal, Canada. I did my medical school there at the McGill University School of Medicine. I did my residency at University of Arizona as internal medicine. And then I got recruited to the Boston area where I spent about 27 years of my career. And that's where I lived for most of my life, my professional life and my network. I also have been over the years a medical director, a chief medical officer. So I've had a lot of experience both in the hospital setting and in the outpatient setting. I've mentored other physicians, other residents, students. I love teaching. I love giving talks to consumers, to the public. So I love to educate. It's wonderful when I can make a difference in other people's lives, even if they're not patients of mine. So I love to do that. I also have an MBA from MIT, so that helps me really be able to deliver that tech, those tools to patients and that ability to streamline their care. So technology and operational efficiency of that MIT helped me with really helps in healthcare. So I landed in Vegas because I was recruited here by a larger health system. After that, I ended up deciding that I really like, because I was recruited in an executive position. And after that, I really decided that I love to work with patients. I still love working with patients. And that's how I decided to open up the concierge practice in Boca Park.
Yes, and it is a fabulous office, but again, you don't even have to go to the office. The great thing is you can text her. And the great thing that she just talked about is not only is she an advocate for her patients, she does like to go out and do talks, and we are going to work together, hopefully with some senior communities that I'm part of. to talk about it. But you can also reach Dr. Nathalie if you have a senior club or maybe a women's group or a men's group, whatever, that want to talk about something particular. Because again, we are responsible for our health. We need someone like Dr. Nathalie to navigate us, not when we're only sick, but hopefully to keep us before, like you talked about prevention. Prevention is king, right? Because once
Absolutely.
yeah, that's what, just like an athlete would say, a lot of times they do a lot of stuff for the prevention, right? That's why they're working out and taking care of themselves and, eating healthy. So, what I would say to folks is, number one, what kind of patient are you? For me, like I said, I would do whatever the doctor said. But then when I had things come up that I did not agree on, then I kind of jumped in and tried to get educated. And a lot of times they were like, wait a minute, you usually would just say yes and do it. And so they didn't like that I changed my personality, I changed my direction. And so she's saying that she's here. She is actually going to be your friend, your advocate. She's going to know, if you really need to come in and talk to her, she's going to pay attention, which honestly,
Well,
most
it's
doctors don't even know your name.
yeah. I mean, it's about, again, about the doctor-patient relationship. It's about that relationship. It's not transactional, so it's not just scheduling visits when you're sick. The sort of the traditional healthcare model. Doctor-led decisions, et cetera. It's really about that open communication with your physician, right? And that's whether it's through video, through phone, in person, etc. That's really important.
Yes, and the other thing is she's a community partner. So she goes out in the community. She plays catch ball, which is like volleyball. She likes to hike. She has a daughter that goes into the school system. She's part of the community. And she's, like she said, she's not transactional. She's here to be your advocate and, possibly be your friend, because we do have a lot of people coming into town, and they don't have a doctor. And they're like, oh, when I go to Chicago, I'm going to go see my Chicago doctor. I'm like, what are you talking about? But we actually have someone here in Las Vegas, folks, that she wants to be your doctor. You're accepting patients, correct, Dr.
Yes, we
Nathalie?
are. Yes, we are.
And yes, she is in the Boca Park area, but guess what? She's a phone call away. So if that's the kind of care you want, and you don't live near Boca Park, I'm sure she can help you with your healthcare needs, right?
Oh, absolutely. I mean, we have patients that come from all in the valley here. So
Absolutely.
Henderson, many different places. And again, you bring up a good point. There are times when I don't need to see you right away. In other words, I can do a video call with you. But there are times when I do need to bring you in, and you need an exam or you need to be seen. So it's a mix. It's really, again, working with you to deliver the best care, the best quality care that you deserve.
Perfect. So when they first meet you, generally they would come into the office, you would do the family history. Is that generally how it is, just so I could get an understanding?
So initially, if people want to meet and greet, we do complimentary meet and greets, whether they want to come on their own or bring a family member. So it's also really important that it's a good fit, right? So we do complimentary meet and greets, really important. And then once they sign up, we gather the records. I go through all the records, and then I bring you in for a full exam and review of your records to make sure that everything is accurate.
So I would tell everybody out there that, doesn't know their doctor, sat in the the x-ray room or whatever room for 45 minutes. I had somebody tell me, I'm here in my underwear for the last 45 minutes waiting for my doctor. I'm like, so you're talking to me in your underwear? I mean, I just, but that's not right. I mean, we want a doctor that cares about us. We want a doctor that when we go there, they're listening to us. They're not looking on the clock. They're not transactional, like you said. So I believe everybody out there that healthy or not healthy, maybe you want to change your health plan, like physically, you want to kind of take care of you. It's a perfect time to give Dr. Nathalie a call. Dr. Nathalie, why don't you go ahead and give the information for people to reach out to you via your phone and your fabulous website that gives a lot of information. Let them know how they can get a hold of you.
Well, you could get a hold of me through my office. We're called Care Partners MD. The website is carepartnersmd.com. And also our phone number, if you don't want to go on the website, you can call us directly at 725-293-7271.
Say it one more time.
So the website is carepartnersmd.com, or you can contact us directly through our phone. And the number is 725-293-7271.
Perfect. And like I said, you can call the doctor if you need the doctor. You can call the doctor because you want to, what did we just talk about? Not, you don't need her, but just preventive care. Because especially, say like me, I'm 58 years old. I need to start doing preventive care. But have someone that's an advocate. Also for you local business owners or new people out there, if you have an opportunity for someone that needs a speaking engagement, Dr. Nathalie is well versed in speaking to small groups, and I know that she would love to do that, right?
Oh, absolutely. Educating the public on their health and issues. I love it. Sometimes business owners will give me a topic that they want, particularly of interest to their employees. And so we could cater it. We could cater the talk based on what the needs are for that particular employer.
Yes, I love that with stress and mental health and everything like that. It's so important to have somebody on your side, someone that is listening to you and caring about you, especially when you need it, right? So thank you so much, Dr. Nathalie. It's been a pleasure meeting you, learning more about you. I know that you are going to be an amazing community leader. I'm looking forward to listening to some of your talks. And I'm hoping that people reach out to you and learn more what Care Partners MD does here in Las Vegas. So thanks for taking time to come on my podcast.
Thank you, Penny. Thank you for having me. I appreciate it.
Yes, and if anybody out there would like to be on our podcast, The Professionals, we talk to local business owners that want to be part of the community. We're looking for people like Dr. Nathalie said, we're not looking for transactional. We want folks that want to build community here in our Las Vegas and Henderson community. So thank you. I'll see you next time on the first and third Wednesday of the month at 10:15. Penny Tendo signing out with The Professionals. Thanks.
PR Connections Radio thanks you for watching this podcast. Check out more episodes of this show and our others at prconnectionsradio.com.